Hello, and welcome to The Gentle Shift Health by Choice, Not by Chance. I am Dr. Aaron Kiefer, and I am taking this time to carve out a little space in our cyberspace in order to talk about health and to talk about how we can improve our health. We all have the power to be healthy. We all have the power to improve our health in some way. And so this podcast is going to focus on that. We're going to have a wide variety of topics. We're going to have episodes where I am simply monologuing and talking about something that's on my mind or something I heard that I'd like to address. I'm also going to be having some guests on the show, some health providers, some professionals in the health world, but also some people that are doing great things in the health world, but they don't have a license, necessarily because they are just doing their own thing. My focus is going to be more on the natural world, as that's how I practice. I am a practicing chiropractor. I am in the natural world. And so I'm going to have more of a focus on the natural side of things. We're going to have a journey and we're going to learn about all sorts of different avenues of health and wellness. And my goal is to empower you and to inspire you to know that you have the power to take care of yourself. You have the power to make yourself healthier, to make yourself better. No matter what circumstance you may be in, there's always something that you can do to make yourself better, to make yourself healthier. And so we're going to be sharing that. You may or may not know, but there are actually 6 different categories of health. The one we're most familiar with is the physical health. And that's what most of the podcast is going to focus on. I am working in the physical world, and so I am going to be talking mostly about physical health. That's my jam. However, we will also be having guests, experts on the show that are going to be talking about the other 5 categories of health, which are emotional health, mental health, spiritual health, environmental health, and social health. And so we will have people to talk about all of those topics and to enlighten us. And, I hope to learn something from this. And I hope you're going to learn something from this. So the title of the show is A Gentle Shift. We are trying to nudge you along on your health journey. This is a health journey. We are all going towards a destination, which amazingly, that destination is completely the lack of health and, ultimately death. So we are on this journey to keep ourselves healthy and to have as enriching and satisfying of a life as we can have. The title also includes health by choice, not by chance, because our health is a culmination of all of the choices we make along the way that ultimately leads to where we are now. And the choices we're making now is going to lead to where we are in the future. And so it's all about learning to take care of our body. It's learning about how to make the right choices. So a little bit about myself. I am Dr. Aaron Kiefer. I am a practicing chiropractor. I have been practicing for 20 years. I've seen many people and helped many people along the way. I take great pride and satisfaction in being able to help someone on their journey. And I just share a small part of that journey. Ultimately, everyone that comes in to see me, they have their own journey that they're following, and I try to help in the ways I can and advise in the ways I can. And it's exciting to see people get better on a daily basis. I've been practicing, as I said, for 20 years. I am a NUCA doctor specifically. NUCA is a chiropractic technique. There are well over 100 different chiropractic techniques. There are many techniques that someone just makes a little tweak and then calls it their own. But there are many techniques that are separate and distinct and very different from one to the other. NUCA is one of those. NUCA is in the classification that is called upper cervical chiropractic. So the focus is working on the upper part of the neck to align the entire spine. Nuka is very unique and it is something that is extremely precise. I will get into more of what I do as the show goes on. My goal is not necessarily to market Nuka specifically, but to give you information about how to take care of yourself, including Nuka, but also including many other avenues. So, one of the things I want to talk about in today's episode is just some general guidelines into what this show is going to be about. And generally, what are some of my health philosophies or how did I get there? So, one of the things I think you need to understand is talking about what causes disease, and it's a lack of function of your body. And so, one of the things I like to do, oddly, is most years I will look and see what are the top killers in America. And so I brought up the list for 2024. So the top 10 causes of death in the United States. Number one is heart disease. That is something that is regularly at the top spot. Number two is cancer. Also, regularly that falls as number two. Number three is unintentional injuries. So these are your accidents that are happening, whether it's car accidents or any other type of accident that might happen. Number four, stroke. Number five, chronic lower respiratory diseases. This includes COPD, emphysema, bronchitis. Number six is an interesting one. It's Alzheimer's disease. This is becoming a greater and greater cause of death in our country. It is growing rapidly. Number seven is diabetes. Number eight is kidney diseases, including nephritis, nephrotic syndrome, nephrosis. Number nine is chronic liver disease and cirrhosis. And number 10, surprisingly, is suicide. Uh, I may be biased, but I believe that all 10 of those have at least some level of prevention to them. We have some power to impact them. And most of them, I'm going to argue, are almost 100% related to choices and decisions we've made. And you can argue the minutia of how much we might be responsible for each individual thing. But the reality is, all of those can be influenced by the choices we're making. And we can make positive choices to either prevent those conditions or to treat them and to improve them. And so that's what I'm talking about with this particular episode and with this particular podcast is we have the power. We have the power to make ourselves healthy and to be well. We have the power to improve our health. And no matter what circumstances you are in, there are always things that you can do to help. It's about all the day-to-day choices that we make that culminate in what our current and our future health is going to be. And I am not immune to it. We are inundated every day with all sorts of messages that are probably not good for our health. We are marketed all sorts of products, all sorts of services that are not beneficial for us. The thing is, things are healthy for us usually aren't marketed. When's the last time you've seen a commercial for water? When do you see commercials for exercise that's not guilting you because you're overweight, right? Like most exercise commercials are just focused on weight loss, but exercise encompasses a whole lot more than just simply losing weight. Most of the commercials we see, whether it's for soda, Coca-Cola, Coca-Cola's sexy, right? It's easy to market. Alcohol, all those things And many other things are marketed, and they're not good for us. They're not healthy. They're not going to help us to they're not going to encourage us to be healthier. We are literally being marketed things that are to our own demise and that will ultimately kill us. You see, the thing is, you don't need to market something good. The reality is, if you have to market something, it's probably not good for you. And when you're making all these decisions, you need to understand it's okay to fall, it's okay to fail. You don't need to guilt yourself because you made all these decisions that weren't necessarily good for you in the past. It's all about starting now to make better changes. It's about giving yourself a pass and not feeling like you have to be perfect. It's all about making improvements on a day to day basis. There's something that I like to talk about in the office, and it's health momentum. You can have positive momentum, you can have negative momentum. And so the more things you're doing that are positive for the body, the more momentum that you generate. I have people come into the office, they've already got a great diet. They're exercising, they have a positive mindset. All those things lead to number one, they heal faster in the office. It's amazing. The people that come into the office, I know before they even start with care, who is going to improve fast and who might take longer. And it's not rocket science. Most of the listeners are going to come to those same conclusions if they were in my shoes. So when we have all this positive momentum, what happens is when we have that thing that might be a little bump in the road, that's all it is. It's a bump in the road. It doesn't completely derail you. You're not completely going off the tracks. It's just a little bump in the road. If you have an injury or you get sick or whatever it is, just a little blip when you have that momentum. When you don't have momentum, when you have negative momentum, it adds on to those. And so suddenly it makes you that much worse and it makes it that much harder to recover. And so making those steps on a daily basis and making good choices builds this momentum, which makes you stronger and more resilient as you go along. It's okay to make poor decisions. You just need to strive on a regular basis to do better. You need to strive to make incremental changes. I was listening to this podcast. It's a Mel Robbins podcast. I've only saw a couple episodes. I don't even know how I got exposed to it. I just opened up my phone. Honestly, I was looking to do this podcast. I opened up my phone and that podcast is up there. No idea who it came from. If you're a listener and you gave it to me, thank you. I appreciate it. But on this particular podcast, she was interviewing a gentleman, and his name is Dr. Rangan Chatterjee. I'm probably saying his name wrong. He's from the United Kingdom, and he's a medical doctor over there. And he really impressed me how he talked. He definitely has a much better idea of the natural world and about supplementing someone's health rather than trying to interfere with it. And he had this quote, and I just thought it so powerful. He said, small changes done consistently lead to big outcomes. I just think that's such a powerful quote. And, that basically is taking my idea of health momentum and summing it up into this concise sentence. Small changes done consistently lead to big outcomes. And that's what this entire podcast is based off of, trying to give you tips, give you advice, expose you to people that might help you on your journey so that you can be improving consistently, regularly. It's the small steps, and the small steps can lead to big things. I'm in the business of taking care of people. Taking care of people is a great toll. It takes a lot for any healthcare provider, not just myself, any healthcare provider. it's a great toll on us. We are there for that person. I'm there taking care of each individual person. I'm there for them. We care a lot for people. Everyone in the healthcare world cares a lot for people. And they do it simply because they just want people to be healthier. I am very well aware that if our world was healthier, if our community was healthier, it would be such a better world. People are happier when they're healthy, right? When you feel bad, you you're moody, you're grumpy, you're short-tempered. I take care of parents in the office, and their young kids know when they need to be taken care of because and I've heard kids say it before, like, "Oh, mom is suddenly snappy, she snaps at me or she's, quickly gets angry at me," or, dad doesn't want to play with me or whatever it is. I've had kids specifically mention to me that they knew their parent needed to be adjusted simply because the parent's attitude changed. You know, yes, we're adjusting someone's spine, but we're really giving an attitude adjustment at the same time. People are happier when they're feeling good. And so that is what I want to do with this podcast. We want to inspire you so that you can have a healthier life. And with a happier life, a more fulfilling life. And that starts with every step that you're taking along the way. And so that's what we're going to be talking about in this podcast, steps to get you at a better place in your life. I'm excited for this journey. I'm excited to get to know a lot of things about other healthcare providers and what they're doing and hear their tips on how to be healthier. So I'm going to be going on this journey right along with you, and I'm going to be imparting my knowledge as I go as well. So I look forward to how this evolves, and please be patient as I learn how to edit and how to interview. In the next episode, I will be discussing a little bit more about some of my personal health philosophies and providing a little bit more for advice and health tips. I thank you for joining me. I thank you for finding this podcast. I hope we can provide information for you now and into the future that is going to be beneficial for you. As for now, I am Dr. Aaron Kiefer. This is the Gentle Shift, Health by Choice, Not by Chance, and I will see you next time. Be well.